Mr. Walter is 74 years old and lives alone in Kentucky. His wife, Carol, passed away 3 years ago. Since then, he's felt his strength slipping, aching joints, poor digestion, and constant fatigue. He used to think, I'm just getting old like everyone else. That changed one morning when he rediscovered an old jar of baking soda that Carol used for baking. Attached was a small note she had written: mix 1 teaspoon with warm water for stomach aches. He tried it, and instead of merely soothing his stomach, he slept better and woke up without the usual headache. From that moment, he began to explore the true benefits of baking soda. Did you know that over 80% of people use baking soda only to freshen their refrigerators, bake treats, or scrub their kitchens? They have no idea that this inexpensive white powder, just a few cents per dose, is hailed by experts as the most powerful forgotten medicine in the world. From reducing joint inflammation and supporting kidney health, to improving digestion, whitening teeth, fighting fungal infections, and enhancing athletic performance, baking soda quietly helps millions, yet few know its full potential. Why? Because no one has ever told them the whole story. If you're looking for a natural, safe, cost-effective solution you can begin using right from your own kitchen, this video is for you. Have you ever sensed a silent inner heat, persistent fatigue, dry and rough skin, or unexplained itchiness, even though your diet and routine haven't changed? Many older adults describe it as their body feeling stuck, unable to eliminate what it needs to. Sometimes a small step that supports natural detoxification can help the whole system return to balance. That's why so many turn to a simple ritual: mixing baking soda into warm water or taking a baking soda bath a few times each week. It may seem almost too simple, but here's the science. Baking soda, or sodium bicarbonate, creates a mildly alkaline environment when dissolved, capable of neutralizing excess acidity both inside and outside the body. In contrast to modern dietary habits that tend to acidify, baking soda gently shifts the balance, supporting your liver, kidneys, skin, and lymphatic system in their natural detox roles. Consider Diane's story. At 67, she suffered from chronic hives and itching after a course of antibiotics. On a friend's recommendation, she tried a 15-minute soak in a warm bath with half a cup of baking soda. I couldn't believe it. I slept a full 7 hours that night, the first time in 2 weeks, she said. Diane is far from alone. Thousands report that baking soda baths soothe dry skin, relieve itchiness, soften connective tissue, and even calm the mind. Although formal dermatology studies are limited, centuries of safe use and overwhelming anecdotal evidence have made this a go-to remedy. Baking soda's benefits extend to kidney health too. Clinical research in the Journal of the American Society of Nephrology found that chronic kidney patients given small daily doses of sodium bicarbonate under medical supervision experienced a marked slowdown in kidney function decline, thanks to its ability to neutralize excess blood acidity. It's important to note that baking soda is not a cure, but rather a gentle aid that helps the body rebalance its pH when internal environments become too acidic. For safe use among seniors, mix 1/4 teaspoon of baking soda into a glass of warm water on an empty stomach once or twice a week in the morning. For a bath, dissolve half to 1 cup of baking soda in warm bath water and soak for 10 to 15 minutes 2 to 3 times weekly. Always consult your physician first if you have kidney disease, high blood pressure, or take regular medications. This is a simple, low-cost habit that, when practiced consistently, can help your body breathe a sigh of relief after years of silently shouldering excess acidity. Do you remember the last time your teeth felt truly smooth and your breath naturally fresh? For many older adults, dry mouth, yellowing teeth, and lingering odors have become quietly accepted as part of getting older. Yet it doesn't have to be that way. With just a pinch of baking soda you can restore cleanliness, confidence, and even a noticeably brighter smile. Baking soda, an inexpensive white powder commonly used in baking, is one of the safest, most effective natural cleansers ever discovered for oral care. When you dab a small amount of baking soda onto your toothbrush and gently brush, you employ a mild abrasive that lifts plaque and stains from coffee, tea, or tobacco without harming enamel, provided it's used correctly. Many first-time users report that their teeth look visibly whiter after only a few sessions and feel cleaner than after regular toothpaste. Beyond its gentle scrubbing action, baking soda's alkaline nature neutralizes excess acidity in the mouth, something few commercial toothpastes achieve. This acid balance is crucial for seniors whose saliva flow may have diminished, allowing harmful bacteria to thrive. By restoring pH balance, baking soda cuts off the bacteria's breeding ground at its source. Clinical research in the Journal of Clinical Dentistry confirms that toothpaste formulations containing baking soda remove plaque and brighten teeth far more effectively than those without it. Additional studies show that rinsing with a baking soda solution can reduce harmful oral bacteria, supporting gum health and fresher breath. For safe, effective use, brush with a small handful of baking soda 2 to 3 times a week, gently brushing for 2 minutes with a soft bristle brush and rinsing thoroughly afterward. In the mornings, rinse your mouth with half a teaspoon of baking soda dissolved in a cup of warm water for 30 seconds to neutralize acids and freshen breath. Avoid daily use to protect enamel from overpolishing. At only a few cents per treatment, this simple habit lets you maintain clean teeth, a radiant smile, and long-lasting fresh breath. Because growing older shouldn't mean losing your confidence when you smile. Have you ever felt a fiery burn rising from your stomach into your chest? It often follows a hearty meal or your favorite spicy dish. That persistent, smoldering sensation in the chest, sometimes accompanied by an unpleasant sour taste in the throat, is known as heartburn, a common symptom of acid reflux. Seniors are particularly prone to this issue because the lower esophageal sphincter weakens with age, stomach emptying slows down, and certain medications for blood pressure or heart conditions can exacerbate reflux. Although there are many antacids on pharmacy shelves, a surprisingly simple remedy may be sitting right in your kitchen: baking soda. 76-year-old Joe shares his experience. Every evening after supper, I had to remain upright, afraid to lie down in case of reflux. One day, my granddaughter handed me a glass of water with a pinch of white powder. "Our family fare's favorite trick," she said. I sipped it, and in 5 minutes, the burning in my chest vanished. Here's why it works. Baking soda, or sodium bicarbonate, is a powerful alkali. When mixed into water, it creates a solution that neutralizes stomach acid, providing immediate relief. Both the American Gastroenterological Association and the journal Gastroenterology and Hepatology recognize sodium bicarbonate as a natural antacid with rapid effectiveness. When ingested, it reacts with hydrochloric acid in the stomach to form salt, water, and carbon dioxide gas, quickly reducing acidity and soothing the lining. For safe use, dissolve a quarter to half teaspoon of baking soda in a glass of warm water and drink slowly about an hour after meals if heartburn strikes. Do not exceed 2 doses per day or use continuously for more than 2 weeks without medical guidance. Because baking soda contains sodium, anyone with high blood pressure, kidney issues, or on diuretics should consult their physician first. Overuse can upset electrolyte balance, cause bloating, or even raise blood pressure slightly. Though it is a natural and generally safe remedy, baking soda should complement, not replace, prescribed treatments. Used correctly, it can bring remarkable relief, allowing you to enjoy meals without dreading an uncomfortable night. After all, each meal in later life is a small joy, and no one wants that joy to be burned away by acid. One of the most common annoyances for older adults, especially those who move slowly, sweat heavily, or wear shoes for long periods, is skin and foot fungus. The persistent itching, redness, peeling skin, and unpleasant odor can drive you to try every topical cream or spray out there, only to have the infection return time and again. Yet many people don't realize that a simple pantry staple can help control fungal growth naturally, safely, and inexpensively. Baking soda. 71-year-old Nancy shared her experience. My feet suffered from stubborn fungus for over 2 years. Every warm day, they turned red, cracked, and itched like ants crawling. My daughter read about soaking feet in baking soda, so I tried it for 15 minutes each evening. After 1 week, I slept through the night without itching, and by week 3, my skin was smooth again and the cracks had vanished. Nancy's story isn't just folklore. A study in mycopathologia found that a 1% baking soda solution, about 10 grams per liter of water, inhibited 80% of the common dermatophyte fungi, including the species responsible for athlete's foot, which frequently affects seniors. Baking soda works because it creates a mildly alkaline environment where fungi struggle to thrive, and it can disrupt fungal cell membranes, weakening their ability to multiply. At home, simply dissolve 2 to 3 tablespoons of baking soda in a basin of warm water and soak your feet for 15 to 20 minutes every evening. Pat your feet thoroughly dry afterward to prevent moisture from lingering. For drier areas, such as between the toes, gently dust baking soda powder as you would baby powder. This helps absorb moisture and inhibit fungal regrowth. Avoid applying baking soda directly to open wounds or weeping skin, and seek medical evaluation if you notice signs of a deeper infection. Baking soda is not a replacement for prescription antifungal medications, but it serves as a powerful adjunct for preventing recurrence, soothing symptoms, and reducing reliance on harsh chemicals. In an increasingly complex pharmaceutical landscape, sometimes simplicity is the greatest strength. Have you ever experienced that burning pain when you urinate, coupled with a constant urge to go yet only a few drops come out? It's an uncomfortable, exhausting, and anxiety-inducing ordeal. Urinary tract infections are especially common in older adults, particularly postmenopausal women, those with limited mobility, or anyone using a catheter. For some, repeated UTIs become a recurring nightmare. In those moments of discomfort, many seek a gentle, natural remedy to ease symptoms before resorting to antibiotics. Baking soda offers such support. 69-year-old Linda recalls her own struggle. I had 4 UTIs in 1 year. The pain was so severe I wouldn't leave the house. Then a nurse friend suggested I try baking soda in water to reduce urine acidity. After a few days, the burning eased. It wasn't a cure, but it made me comfortable enough to wait for my prescription. Linda's experience reflects a real physiological principle. When urine becomes too acidic, UTI-causing bacteria thrive, intensifying that painful burning. Baking soda's alkalinity temporarily neutralizes excess acid, soothing discomfort, and helping the body flush out harmful microbes more easily. A small study in the Japanese Journal of Urology tested 33 women with recurrent UTIs. Those who took a low daily dose of sodium bicarbonate reported significantly fewer episodes of painful urination, burning, and overall discomfort after 4 weeks, compared with those who did not use it. It is crucial to understand that baking soda does not replace antibiotics for treating serious infections. Instead, it serves as a mild adjunct, reducing urine acidity and providing temporary relief while you seek proper medical treatment. For safe use, dissolve 1/4 teaspoon of baking soda in a glass of warm water and drink it on an empty stomach once a day for 3 to 5 days when minor burning begins. Be sure to stay well hydrated, maintain good hygiene, and rest. Do not use this remedy if you have high blood pressure, are on diuretics, or have kidney issues without first consulting your doctor. For older adults, finding a safe, natural way to soothe symptoms at home can be invaluable. Sometimes the simplest solution lies in a small, forgotten jar tucked away in the corner of the kitchen. Have you ever been walking and suddenly felt your legs go weak, forcing you to stop? Or begun a gentle workout only to experience burning muscles, shortness of breath, and fatigue that lasts the rest of the day? That sensation isn't just a sign of aging. It results from the accumulation of lactic acid in muscles, known as acid-lactic buildup, which is the primary cause of muscle soreness, cramps, and premature exhaustion during physical activity. What few people realize is that a small amount of baking soda, taken at the right time, can help you move longer, feel stronger, and recover faster, especially for older adults striving to maintain daily exercise. 72-year-old Raymond shared his experience. After retiring, I began my morning walks, but after 20 minutes, my knees and calves ached terribly. One day I read that baking soda before exercise might help, so I mixed half a teaspoon in warm water before heading out. To my surprise, I walked 40 minutes without the usual fatigue. This isn't just anecdote, it is science. During exercise, muscles produce lactic acid, lowering pH in muscle tissue. That burning sensation and loss of strength happens because the acidic environment hinders normal muscle cell function. Baking soda, with its alkalinity, neutralizes this acid and allows muscles to continue working smoothly. A large review in the Journal of Strength and Conditioning Research found that supplementing with sodium bicarbonate enhances performance in short, high-intensity activities such as brisk walking, stair climbing, or lightweight training. With particularly notable benefits for those over 60, users experience delayed onset of muscle fatigue, increased endurance, faster recovery, and reduced delayed onset muscle soreness after workouts. For safe use, dissolve a quarter teaspoon of baking soda in a glass of warm water and drink it 30 to 60 minutes before light exercise. Avoid taking it on a very full stomach and limit use to once per day. It's important to consult a physician if you have kidney disease, high blood pressure, or use diuretics, as baking soda contains sodium that can alter electrolyte balance. Daily movement is the most powerful rejuvenation tonic for older adults, but supporting your body before and after exercise makes all the difference. A small spoonful of baking soda, used correctly, could help you walk extra laps around the park, climb a few more flights of stairs, and feel energized throughout the day. After all, healthy living isn't about sprinting, it's about steady, comfortable movement every single day. Do you remember waking up and feeling stiffness so intense that even a slight bend of the knee brought pain? For millions over 65, arthritis, gout, and kidney disease become unwelcome daily companions, turning simple movements into struggles. Yet inside your own kitchen, you may have a natural inflammation regulator studied by leading immunologists worldwide. Baking soda. 73-year-old Marjorie battled rheumatoid arthritis for over a decade. Every morning I needed 30 minutes just to get out of bed, she recalls. One day I stumbled across a study suggesting baking soda could dial down an overactive immune response. I tried half a teaspoon each morning, and 2 weeks later, my hands no longer swelled every dawn. This outcome is more than coincidence. A 2018 Journal of Immunology paper demonstrated that daily baking soda intake can shift the immune system from a pro-inflammatory to an anti-inflammatory state by reprogramming macrophages, the immune cells at the heart of autoimmune conditions like arthritis. Gout, triggered by uric acid crystals building up in joints, brings sudden pain, swelling, and reddening. Baking soda's alkalinity helps neutralize excess acid in blood and urine, promoting the dissolution of uric acid and reducing the risk of acute attacks. Research in arthritis and rheumatism confirms that mild urine alkalinization with low-dose sodium bicarbonate increases uric acid excretion, easing pain and lowering relapse rates. Chronic kidney disease, especially in its early stages, also benefits from baking soda. By neutralizing excess blood acidity, it eases the kidney's workload and slows disease progression. A finding supported by the Journal of the American Society of Nephrology. This gentle buffering action helps maintain kidney function over time. For safe home use, dissolve 1/4 to half a teaspoon of baking soda in a glass of warm water and drink once each morning on an empty stomach, limiting continuous use to 2 weeks unless directed otherwise by a physician. Always take it apart from meals and prescription medications. Because it contains sodium, anyone with high blood pressure, fluid retention, heart failure, or advanced kidney disease should consult their doctor first. While baking soda is not a substitute for medical treatment, it can serve as a mild, supportive step to reduce inflammation, ease movement, and preserve a measure of freedom in every step. Sometimes the forgotten remedy is the right one. Baking soda is often joked about as the miracle powder because the more you learn, the more surprising uses you discover. Beyond its well-known roles in digestion, inflammation control, and exercise support, it offers a host of simple applications that can meaningfully improve daily life for older adults. You might neutralize painful mouth ulcers by rinsing with half a teaspoon dissolved in warm water for 30 seconds, 2 to 3 times a day, helping to balance acidity, reduce bacteria, and soothe inflammation so sores heal faster. When nasal congestion from colds or allergies strikes, you can prepare a gentle rinse by mixing a 1/4 teaspoon each of salt and baking soda into a cup of cooled, boiled water. Administering this solution with a small dropper or spray bottle helps thin mucus, calm irritated nasal membranes, and clear passages naturally, without relying on harsh decongestants. Many seniors find this homemade spray both soothing and remarkably effective at easing stuffiness and reducing sinus discomfort. For body odor, baking soda can replace chemical antiperspirants. After showering, lightly dust a pinch of powder under the arms, or blend it into coconut oil for a creamy, natural deodorant to neutralize sweat acidity and block odor without aluminum compounds or skin-irritating additives. Similarly, when insect bites or mild allergic reactions cause redness and itching, a quick paste of baking soda and water applied to the affected skin can ease the urge to scratch within minutes, thanks to its pH balancing and soothing properties. Those who spend long days on their feet will appreciate baking soda's callus softening benefits. A weekly foot soak with 2 to 3 tablespoons in warm water not only combats fungal growth, but also gently exfoliates hardened skin on heels and soles, leaving feet smoother and less prone to cracking. Regular soaks can be a restorative ritual for anyone whose daily routine involves long periods of standing or walking in closed footwear. Despite its many benefits, baking soda is not suitable for everyone. Because it contains sodium, those with high blood pressure, fluid retention, heart failure, or kidney impairment must exercise caution. It may interact with diuretics or corticosteroids, and it is generally best to avoid prolonged daily oral use, especially for pregnant or breastfeeding women or anyone with open wounds or highly sensitive skin. Over-alkalinization can disrupt digestion, lower potassium levels, cause dizziness, and even affect heart rhythm. The wisest approach is to use baking soda in short 5 to 7 day courses, listen to your body's signals, and coordinate with regular medical checkups if you have chronic conditions. After all, the greatest value isn't in finding a brand new remedy, but in learning to use what we already have, at the right dose and at the right time. 13 benefits. One simple powder. and perhaps a new opportunity for your health. No flashy ads, no fancy packaging. Baking soda, that little white jar in your kitchen, has quietly supported us for over 150 years, from baking bread to everyday home remedies. Whether it's a soothing morning drink, softening cracked heels, or brightening your smile, baking soda shows that true health can spring from very simple things if we take time to understand and listen to what our bodies really need. You don't need to overhaul your life today. Choosing one small habit, like a warm glass of water with baking soda in the morning, a gentle foot soak at night, or swapping your deodorant for this gentle powder, is already a victory in living more fully and independently. Which of the 13 uses resonated most with you? Drop its number or name in the comments. We read every reply and can't wait to hear your experiences. If this video helped you, please like, subscribe, and share, because sometimes a single glass of water can spark a healthier life.